This question is a great question and comes to me from Cynthia. Cynthia says, can you explain the difference between calcium orotate and calcium citrate? What are the pros and cons of each? First of all, a lot of people, this is a great question. There's a lot of different forms of calcium on the market today. If we take calcium and look at its basic structure, calcium is just like a rock. All calcium is basically calcium carbonate. Calcium carbonate is chalk. Many supplements out on the market today, if you look at the ingredients, say calcium carbonate. Calcium carbonate, if you put a stick of chalk in some water, it'll never absorb, it'll never dissolve. And believe it or not, most people are getting ripped off left and right out there in the market because they're going and thinking that they're buying calcium and it's actually calcium carbonate. Now, what companies do so they can increase the absorption is they attach what's called a chelating agent to the calcium carbonate. So, this would be calcium citrate. All they do is attach citric acid to the calcium carbonate, which is going to increase the absorption of the calcium. And even the body chelates calcium. I mean, when I say chelate, the definition of chelate is attaching another substance to calcium to make it more absorbable. There are many forms of calcium: calcium arginate, calcium aspartate, calcium hydroxyapatite, calcium lactate, calcium malate, calcium citrate, calcium orotate. All of those are just more or less chelating agents that you're attaching to the calcium carbonate molecule. The question is, what forms of calcium are going to be absorbed and where are they going to be? Dr. Nieper, who wrote a book called The Curious Man, which I would recommend, to me is the leading expert. He's all passed away now, but to this day he has done the most research on mineral transport systems in the world. I would definitely recommend you get his book. But according to him, there's basically 4 types of absorbable calcium. Calcium, depending on where you want the calcium to go. You have calcium aminoethyl phosphate, and that form of calcium is extremely effective for neurological problems. It delivers calcium to the nerve cells, and the calcium also goes to the outer layer of the cell membrane. See, the question you need to ask is, do I want my calcium going into the extracellular fluid? Do I want it going to the outer cell membrane? Do I want it going to the inner layer of the outer cell membrane? Do I want my calcium going into the mitochondria of the cell? So your question regarding the difference between calcium orotate and calcium citrate, calcium orotate is the only known form of calcium which is going to penetrate all the way through the cell membrane and penetrate into the mitochondria of the cell. Calcium citrate, on the other hand, you're lucky if that even gets to the cellular fluid, let alone even to the outer layer of the cell membrane. And the cell membrane is the powerhouse of the cell. So, the only forms of calcium that I've ever used and that I'll ever recommend are calcium aminoethyl phosphate, calcium arginate, and calcium aspartate. So every other form of calcium out there is going to be inferior, and the calcium orotate is what I use pretty much on a regular basis because everybody is deficient in calcium. Just one more point is, if anyone drinks milk, pasteurized milk, the pasteurization process of milk creates calcium carbonate. So when people drink high levels of milk or pasteurized dairy, what they're doing is they're actually feeding their body more calcium carbonate. When the body gets calcium carbonate into the system without a chelator, it has to take calcium, it has to pull calcium from the bones and the tissues and the muscles in order to buffer the calcium carbonate in the blood. This causes osteoporosis. So when you hear milk does the body good, it actually does the body bad, because milk actually causes osteoporosis in any type of pasteurized, as well as all the people that are going out there getting calcium carbonate supplements. So great question. Big thing is avoid calcium carbonate at all. If you're going to take calcium citrate, you're only going to get about 30% absorption. If you want 80, 90, 100% absorption, calcium aminoethyl phosphate or calcium orotate. Thank you.